Hello, and thank you for joining us at the Harrison Township Public Library for our senior seminar. Today, we're joined by Bev Clark from the Medicare Medicaid Assistance Program of the Area on Aging 1B. Thank you for joining us, Bev, and I'll let you take it away.
Thanks very much, Mary. I appreciate it. Hello, everyone. I am here today to tell you how to take charge so you can help prevent Medicare fraud and abuse. Now, the word scam is in the top of the news these days, and I'm sure everyone's had at least one situation that you thought might be a scam. So by the end of this presentation, I hope you'll have learned some tips that you can use to ensure that you prevent, detect, and report fraud and abuse when it happens. Now, as Mary mentioned, I am with Michigan's Medicare Medicaid Assistance Program at the Area Agency on Aging 1B. I am the coordinator for Macomb County of the Medicare Medicaid Assistance Program. We're a free health benefit counseling service for senior citizens and disabled adults. And our goal is to help you find your way through the healthcare benefits maze. Now, the Medicare Medicaid Assistance Program is housed at area agencies on aging and other similar organizations throughout the state. Your local map at the Area Agency on Aging 1B serves Oakland, Macomb, St. Clair, Washington, Livingston, and Monroe. Now, MAP is also Michigan's SMP, which is the Senior Medicare Patrol. We are part of the National SMP Network, which empowers and assists Medicare beneficiaries, their families, and caregivers in preventing, detecting, and reporting healthcare fraud, errors, and abuse. And I'm here today representing the SMP, the Senior Medicare Patrol. So our topic today is Medicare fraud and abuse. So you might be wondering, why should you care about Medicare fraud? Well, Medicare fraud, errors, and abuse affect everyone. Are you a Medicare beneficiary? Is someone you know or love on Medicare? Are you a caregiver for someone who has Medicare benefits? Do you pay taxes? If any of these are true, then you should care about Medicare fraud. Each year, Medicare loses billions of taxpayer dollars to improper claims. Now, this puts the Medicare Trust Fund at risk for everyone and affects the future of the Medicare program. Medicare fraud, errors, and abuse also affect current Medicare beneficiaries because they result in higher Medicare premiums. Each instance of fraud or abuse wastes money that could be used to increase and improve healthcare services rather than raising premiums. Medicare fraud, errors, and abuse can also cause serious personal consequences for beneficiaries, such as medical identity theft, negative health impacts, and personal financial losses. So let's go through each of these one by one. First, medical identity theft. Medical identity theft occurs when your Medicare number is misused, either by a provider, a supplier, or by someone posing as you in order to receive medical care. Such Medicare numbers are considered compromised. The newly issued Medicare cards no longer use your Social Security number as your Medicare ID. It's now a random combination of 11 numbers and letters, as shown on this sample card. However, the new Medicare number is still uniquely yours, and in the wrong hands, it can impact you directly. Now, know that unlike Social Security numbers, Medicare numbers can be replaced if they're stolen or misused. But this is not an easy process, and it may take months or even years to resolve a Medicare number theft. Next, negative health impacts. Receiving health care from a fraudulent provider can mean the quality of the care is poor, the care is not medically necessary, or worse, the care is actually harmful. Also, a patient may later receive improper medical treatment from legitimate doctors as a result of inaccurate medical records that contain false diagnoses, records showing treatments that never occurred, misinformation about allergies, incorrect lab results. Additionally, because of inaccurate or fraudulent claims to Medicare, you may be denied needed Medicare benefits in the future. For example, some products and services have limits. If Medicare thinks such products and services were already provided, they will deny payment. And third, personal financial losses. Medicare fraud, errors, and abuse can all result in higher out-of-pocket costs, such as co-payments for healthcare services that were never provided, were excessive, or were just medically unnecessary. Now, beneficiaries may also find themselves stuck with bills for services from providers who should have billed Medicare, but instead billed the beneficiary for the entire cost of the service. Medicare frequently pays only a portion of a treatment or service, and while providers normally have an agreement with Medicare to accept the amount as payment in full, a fraudulent provider may attempt to collect the entire costs directly from you. Now, keep in mind that even though your new Medicare number, the number on your Medicare card, is no longer your Social Security number, it can also be used fraudulently to obtain goods or services. It should be protected as securely as you protect your Social Security number. Also, keep in mind that there may be legal and financial consequences for you as a beneficiary if you are complicit in fraud and abuse, since participating in schemes to defraud Medicare is illegal. So simply put, Medicare fraud involves intentionally billing Medicare for services that were not received, or billing for a service at a higher rate than is actually justified. So what is Medicare abuse? Medicare abuse occurs when providers supply services or products that are not medically necessary or that do not meet professional standards. Now, this is one that you're probably familiar with, right? TV ads that tell you they can get you a back or a knee brace, quote, at little or no cost to you, unquote, as long as you give them your Medicare number. Now, the key words here are medically necessary. If your doctor determines it's medically necessary for you to have a brace or a wheelchair or a walker, your doctor should also direct you to a legitimate supplier of these devices. You should never order from a company that sends you equipment sight unseen with no way of knowing if it's right for you. And your doctor should also make sure that Medicare is legitimately billed for any item that he or she prescribes to you. Medicare fraud and abuse are very similar and many times overlap. So here are some examples of Medicare fraud and abuse. Billing for services, supplies, or equipment that were not provided. Billing for excessive medical supplies that you don't need. Obtaining or giving your Medicare number for free services. Treat any offer of free services in exchange for your Medicare ID number with caution. Improper coding of treatments to obtain a higher payment. Unneeded or excessive x-rays and lab tests. Claims for services that are not medically necessary. And using another person's Medicare number or letting someone else use your number to obtain medical care, supplies, or equipment. A primary area of Medicare fraud are prohibited marketing practices. Medicare plans cannot conduct unsolicited phone calls to you if they've had no prior contact with you or no prior relationship. They cannot send unsolicited emails to beneficiaries who have not agreed to receive emails. They cannot mail or call a beneficiary who has requested to opt out of receiving such communication. They cannot represent themselves as though they come from or were sent by Medicare, Social Security, or Medicaid. They cannot make unsolicited home visits, i.e. door-to-door cold calling. They cannot initiate a discussion about other insurance products, such as life insurance or annuities, during a visit or meeting that is specifically about a Medicare product. In addition, Medicare plans are not allowed to leave information such as leaflets, flyers, door hangers on your car or at your residence unless you were a no-show for a pre-scheduled appointment. They're also not allowed to return uninvited to your home to talk face-to-face if you were earlier a no-show. Okay, let's talk a little bit about scams. Medicare scams are a growing problem and are most likely the issue you will encounter as a Medicare beneficiary. Because of easy access to contact information, your name, address, and phone number, scammers may contact you by mail, phone, door-to-door, and other ways. Many of these quote-unquote salespeople are trying to sell you products or services that are either not covered or not appropriate for your personal situation. So let's talk about a few of these scams specifically. Medicare fraud via mail and phone. Scams almost always involve a phone call or an email coming to the home of the Medicare beneficiary. The caller or emailer often identifies himself as someone from an official sounding agency like Medicare or Social Security, or the IRS, or even the bank. The caller may already have some of your personal information and then asks you to verify the information they have before moving on to pushing you for information that they don't have. Beneficiaries are asked to divulge information like Social Security numbers, bank routing or checking account numbers, or credit card numbers. You'll then be told the item or service is free to you, or that this information is needed to correct an error before your benefits get cut off. You may also be threatened with the loss of benefits if you don't give the information or if you don't pay something, generally with a money order or a gift card. There are a few current issues that are big scams right now. You may have heard of them on the news. Genetic testing, Social Security scams, free durable medical equipment. That's the scam to get your Medicare number through offering a free brace, wheelchair, or other equipment, and COVID-19 testing and vaccinations. Okay, Medicare fraud, genetic testing. This is something that's very common and that you need to watch your billing and your Medicare notices to find evidence of. So what is genetic testing fraud? It occurs when Medicare is billed for a test or screening that was not medically necessary or was not ordered by your physician. Some examples of the way you may see this advertised is genetic testing for cancer screening, especially hereditary cancer screening, DNA screening, dementia screening, Parkinson's screening, or even screening for how your genetic makeup affects your response to particular drugs. Genetic testing is fraud when a company offers you free testing without a treating physician's order and then bills Medicare. This may be done by a company requesting your Medicare number at a community event or expo. The company will then administer a quickie test or screening that you or your doctor never requested. And then the company bills Medicare for that screening, which does not apply to you and is not covered by Medicare without doctor's order. So when is genetic testing covered? Under doctor's orders. When someone has stage 3 or 4 cancer, when a test is medically reasonable for the diagnosis or treatment of your illness or injury, when it's ordered by your doctor to treat a specific medical problem and the results are used in managing that problem, when treating physician orders the test as a diagnostic service and uses the results to manage your condition, or when one or more coverage requirements are met for colorectal cancer genetic screening. Now, this is the only Medicare coverage for genetic testing that's offered as a screening service. So what can you do to stop genetic testing fraud? Be sure your doctor has assessed your condition. Medicare covers many, but not all genetic tests for diagnostic use. Do not give out your personal information or accept screening services from someone at any community event. Always read your Medicare summary notice or your explanation of benefits. Words that you want to look for are gene analysis or molecular pathology. Those two phrases may indicate genetic testing has occurred that you didn't know about. If you find anything unusual in your statements, report your concerns about billing errors or possible fraud and abuse to us, your local senior Medicare patrol. Social Security phone scam. This is probably something you're familiar with. Someone calls you or you get a recording where they're pretending to be someone from Social Security, Medicare, or the IRS. Or you receive a quote unquote official letter or email that can also contain your personal information. The caller or letter may claim that you have been a victim of identity theft or claim that you've been hacked. They may threaten to arrest you or sue you, and they often require you to purchase gift cards, send cash via a wire transfer, or pay using Bitcoins or via a prepaid debit card. Now, many people are familiar with these scams, but scammers are increasingly skillful and it's easy to be fooled. So to avoid these scams, keep in mind that in nearly all cases, Social Security will mail you a letter if there is a problem. You will not get a phone call. You will not get a threat. Never pay a fee or fine using retail gift cards, cash, internet security, wire transfers, or prepaid debit cards. That's a fee for anything, government or non-government fees. These methods of payment are extremely difficult to trace and recover. If you receive a call or email that's suspicious, hang up or do not respond. And again, contact your local senior Medicare patrol, that's us, with as many details of the contact that you received as possible. And we can help you report it. COVID-19 testing and vaccinations. This is the latest area in healthcare, and it is the latest area for scams. So be aware. As the number of people in communities affected by COVID-19 grows, so do the scams associated with it. Scammers use public health emergencies as opportunities for new fraud schemes, and because older adults are at greater risk for this serious illness, they may target older populations. Scammers are using COVID-19 testing treatments and vaccinations as opportunities to prey on unsuspecting beneficiaries. Be vigilant and protect yourself from potential fraud concerning COVID-19. Things you need to remember: Medicare will cover the cost of the FDA-approved vaccine when it's available to you. You cannot pay to put your name on a list to get a test or the vaccine. You can also not pay to get early access to the vaccine. You will not be solicited door to door to receive the vaccine, nor through the mail or email. No one from Medicare or the health department will contact you to offer an early chance to get the vaccine. No one from a vaccine distribution site or a healthcare payer like a private insurance company will call you asking for your Medicare number, Social Security number, or your credit card or bank account information to sign you up to get the vaccine. It's important to remember that although the Centers for Disease Control and Prevention and other public health officials may contact you if they believe you have been exposed to the virus, they will not need to ask you for any insurance or financial information. So regarding COVID-19, as with other instances or illnesses, your doctor and your own healthcare system should always be your source of information regarding testing, treatments, or vaccination. Contact your own doctor if you're experiencing potential symptoms of COVID-19 and with questions about testing and vaccine availability. Do not give out your Medicare number, Social Security number, or personal info in response to unsolicited calls, texts, emails, or at public venues. If your personal information is compromised, it may be used in frauds other than a COVID-19 fraud as well. Beware of offers of products, treatments, or medicines to prevent the virus. Check with your healthcare provider before paying for or receiving any COVID-19 related treatment. If you get a call, text, email, or even someone knocking on your door claiming they can get you early access to the vaccine, stop right there. That's a scam. Carefully review your Medicare summary notice and explanation of benefits, and look for errors or claims for products or services that weren't received. And by all means, follow the instructions of state and local government as well as your physician for other actions you should be taking in response to COVID-19. So what can you do about healthcare fraud and abuse? If you've identified one of these issues that we've highlighted in this presentation, what do you do next? That's why we scheduled this talk today, not only to let you know what to look out for, but to let you know how to handle it. So for help with addressing any of these fraud or scam issues, contact us, the Senior Medicare Patrol, because we exist to help you avoid and report these problems. The Senior Medicare Patrol helps Medicare and Medicaid beneficiaries across the country prevent, detect, and report healthcare fraud. By doing so, we help preserve the integrity of the Medicare and Medicaid programs. And because this work often requires one-to-one contact to be most effective, SMPs nationwide rely on approximately 5,000 highly trained volunteers who are active each year to help in this effort. And as I mentioned at the beginning of the presentation, I'm representing the Macomb County Senior Medicare Patrol. So these volunteers are boots on the ground right here in your own community. So what can you do to take charge and help prevent Medicare fraud, errors, and abuse? It's easy. Protect, detect, and report. First, protect yourself and your loved ones from Medicare fraud and abuse. Treat your Medicare and Social Security cards and numbers like you treat your credit cards. Don't give out your Medicare number except to your doctor or other Medicare provider. Don't carry your Medicare card unless you will need it. Only take it to doctor's appointments, visits to your hospital or clinic, or trips to the pharmacy. And note, there's no need to carry your Medicare card at all once your healthcare providers have the number on record. A very safe policy to follow is, remember, if you see a phone number on your caller ID or your cell phone and you don't recognize it, you do not have to answer it. If it's someone who's trying to reach you directly, they will leave a message. But it could be a robocall, in which case the call will disconnect if you don't answer it and you'll never have to deal with it. If you do answer a call from an unknown number and it's a robocall, that call can automatically confirm that you have a working phone number, and other scammers may try to contact you as well. Here's one special detail that you should remember. If you do end up on a phone call with someone whose identity that you can't confirm, do not respond to any question with the word yes. The caller may be recording you, and then they will have your voice saying yes as a recording, which they can use for additional scamming. What should you do? Watch out for identity theft. Scam artists will not only use your Medicare number to defraud the Medicare system, but this is also one way that people can steal your identity. Be aware that Medicare doesn't call or visit to sell you anything. Medicare does require some of their contractors to contact beneficiaries from time to time, but make sure to be vigilant. Keep in mind, you don't have to talk to anyone who calls you or shows up at your door who you don't trust. Medicare contractors will understand that. If you're unsure, state that you will call them back and ask for the name of their company, not just the phone number, so that you can look them up. Do be cautious of offers for free medical services. If it sounds too good to be true, it probably is. And do pass it on. Share this information with friends and family members who might not already know how to prevent Medicare fraud and abuse. So detecting Medicare fraud and abuse. Even when you do everything right, there's a chance that you could be a target of healthcare fraud. There are many ways that your personal information can be used without your permission. Get a notebook to keep a record of your doctor visits, your tests and procedures, or use your calendar to make thorough notes. Always review your Medicare summary notice and your explanation of benefits for mistakes. Look for 3 things on these statements: charges for something you didn't receive, billing for the same thing twice, and services that were not ordered at all by your doctor. Compare your summary notices and other statements with your personal health care notes and with your prescription drug receipts to make sure that everything is correct. You can also set up a free account at mymedicare.gov that will give you 24-hour access to your current Medicare account. And finally, report suspected Medicare fraud and abuse. First, if you have questions about information on your Medicare summary notice or explanation of benefits, call your doctor or your health plan to find out if it was an error that they can correct without you taking any further action. If you're not satisfied with the response you get, or if you're just not comfortable calling your doctor or your plan about a possible error, gather all the facts that you can about your situation. Make sure you have your documents in front of you and contact us, the Senior Medicare Patrol. We are happy to help you investigate and report this service. Keep in mind that the service we provide is free and it's absolutely confidential. And there's our phone number. Go ahead and make a note of it, 800-803-7174. So your 3-step review. Remember, this is how you can take charge and help prevent Medicare fraud, errors, and abuse. Protect, detect, and report. And remember to take what you know and pass it along to friends and loved ones who might not be as familiar with this information. Again, this is how you contact your state Senior Medicare Patrol. With Michigan's Medicare Medicaid Assistance Program, we are 2 programs. We are 1 program with 2 different names. We handle both functions. So you can visit online for more information at smpresource.org. Again, there's our toll-free number, 800-803-7174. That's to report suspected fraud and abuse, or if you would like additional training to become a Senior Medicare Patrol volunteer, or if you'd like a speaker or materials for another group that you belong to. I would like to thank you for attending this remote presentation today and reinforce that if you have any questions or if you need to report an instance of possible fraud or abuse, please call us at 800-803-7174. And also, if you would like a copy of this presentation, I know I offered a lot of information, but feel free to call us at our 800 number, or you can call the Harrison Township Public Library, the presenters of this talk today, and request a copy of the presentation. We'll be happy to send you one via email or via US mail, whatever is convenient for you. So thank you again for viewing the presentation. Stay safe and stay aware.